Welcome. I am Derwin Smiley, and I am on location at the wonderful headquarters of Eli Lilly Incorporated. And on today's show, we will discuss clinical trials, the importance of having minorities participate more. I am glad you are with me, and that show starts right now. Mr. Michael Jones is the Senior Director of Regional Clinical Operations for Eli Lilly. Mr. Jones, welcome to the show.
Thank you, Derwin. Pleasure to be here.
Well, I'm glad that you decided to come on and be on the show also. Can you tell me what is your responsibilities?
Sure. My organization is responsible for identifying physicians who are interested in conducting the clinical studies that our company sponsors. So I have staff all over the world, and specifically in the United States, that go and identify sites who are both capable and interested in conducting clinical trials.
As I was doing my research, came across the information that 17% of minority participate in these clinical trials. What is your strategy to make that number greater?
Yeah, well, historically, you might know that people of color have been underrepresented in clinical studies that pharmaceutical companies have sponsored. And for us, it's really important that we enroll populations in our clinical studies that are representative of those who are afflicted by the disease. And that's a key part of our corporate strategy. So my team is very focused on pursuing new clinical centers that have access to populations of minority group member patients who might be interested in participating in clinical trials. So it's a renewed focus. It's something we've always been interested in, but we're placing more emphasis on those conversations with sites that might have an interest in participating in clinical trials.
Yes. What are some organizations that you have partnered with to reach out to the African American community?
Well, specifically, we're working with the National Medical Association, which is an organization that's focused on physicians, of African American physicians across the country. And we've partnered with them in a program that they have developed and implemented called Project Impact. And Project Impact specifically is focused on improving the number of sites that are capable of conducting clinical trials and reaching out to new centers who are interested in pursuing clinical research as another avenue of their practice.
Do you have any success stories where you could tell us?
Well, sure. One of the specific objectives we had was to include new centers, at least 2 new centers in studies that we were starting over the last couple of years. And we've actually been able to do much better than that. We're including something more like 6 or 7 new centers per study that we started that have broader access to people of color to participate in clinical trials. So about 83 new centers are new to us, for example, have been added over the last year to focus on recruiting patients of minority groups into clinical trials. Several of those centers actually were contacts that we made through the NMA, and in every case, those have been very productive interactions.
What are some of the barriers that you have, or hurdles that you have to overcome to get more people of color to participate?
Great question. I think one of the key barriers is simply awareness of clinical research and what it's about, what the opportunities to participate are, what are the protections that are in place. I think there's historical skepticism about participating in clinical research, and that's always a barrier that we need to overcome. So specifically, we target using tools and materials to educate both investigators, referring physicians, and the broader population in a specific area with regard to what those opportunities are, and to educate them more on what clinical research is all about.
So what is your goal, short-term goal? We can go with like 3-year goal, 5-year goal.
Well, our short-term goals are to ensure that we're enrolling clinical studies with patients that represent those who are afflicted by the disease. So if we look at diabetes, for example, we want to make sure our clinical trial populations are representative. In other words, the same number of minority group members from a proportion standpoint are represented in the study. And that's a very real short-term goal that we're trying to match. So we measure that every year to see, are we making progress towards that goal.
Wonderful, wonderful. So in the future, looking down into the future, as I said, the 70%, what is a realistic goal to get that number up?
Well, that number will change depending on what disease we're talking about. So for diabetes, I'm not sure I could tell you off the top of my head what that number would look like, but for sure it's going to be bigger because it's been underrepresented in the past. Specifically for the U.S. population, when we look at cancer, we want to make sure, again, that we're focusing our efforts there. So I don't know what the number is, Derwin, but it's going to be bigger, much bigger.
Why is Eli Lilly so passionate about this?
Well, our whole corporate strategy, Derwin, is focused on improving individual patient outcomes. And in order for us to be confident about that, we feel like we need to, at a minimum, study the types of individuals that are affected by the disease. And historically, we're relying on data produced in predominantly white males to provide information to physicians for use in all the patients that they see. And we hear more and more from the physicians and from the payers and from patients that they want to have more assurance that the information we have about our products is information collected from people like them. So that's why it's important to us.
Okay. He is Mr. Mike Jones, the Senior Regional Director of Clinical Operations. Mr. Jones, thanks for coming on.
Thank you again, Derwin.
Thank you.
High blood pressure medication in Cleveland, Ohio.
Arthritis medicine in Caliente, California.
Cholesterol pills in Peoria, Illinois.
I'm Montel Williams. Mile by mile, Americans are getting help paying for medicine through the Partnership for Prescription Assistance.
PPA is a lifesaver.
I'm saving about $650.
It wasn't complicated at all.
5 days later, there was my medicine, and I jumped for joy.
If you need help, you don't have to wait for the bus to get on board. Just call 1-888-4PPA now to see if you may qualify. A trained specialist will help you apply. Just tell them the names of the medicine you take. You could get them free or nearly free.
With the PPA, I can take my medicine daily.
I would like to thank them 100 times, 1,000 times, 1,000,000 times.
I've always heard where there's a will, there's a way, and I think this was our way.
So whether you're in Morgantown, West Virginia, or Bangor, Maine, call this free service at 1-888-4PPA now. The Partnership for Prescription Assistance, on the road to helping you.
I am on location at the Eli Lilly headquarters in the wonderful Circle City of Indianapolis, Indiana, with Dr. Theressa Wright. Ms. Wright, thanks for coming on the show.
Thank you so much for having me.
First, to start off, can you tell me what made you go into the medical field?
Actually, it was due to childhood illness. I was about 12 years old. I came out, had rheumatic fever. It involved my heart valve, and I was in the hospital for a month. And being in the hospital, I was around all the nurses and doctors and everything. And up to that point, I wanted to be a nurse, but after I had been around the doctors, I said, no, I think I want to be the doctor. And so that's where it began back then.
So you like to be in control.
That's what my husband says, yes.
Oh, wonderful. I heard that a little bird told me that you do a lot of work with helping other minorities go into the field of medicine.
Correct.
Can you spend a few minutes about your programs?
Okay. Well, you know, that actually just, again, out of my interest in wanting to make sure that children of color have an opportunities, and a lot of times it's because they haven't really been exposed. So I work with a lot of grade schools, high schools, colleges, and